नमस्ते दोस्तों, आपका बहुत बहुत स्वागत है RSSDI डायबिटीज बाइट्स में। आज का एपिसोड जो है वो हम उसके ऊपर फोकस करने वाले हैं, जो कि एक बहुत ही ज्यादा कॉमन और बहुत ही ज्यादा प्रख्यात या बहुत ही ज्यादा आसानी से लोग बोल देते हैं कि PCOS है मुझे, वैसी एक कंडीशन है। इनफैक्ट मैं कुछ ही दिनों पहले मैं कुछ काम कर रही थी और टीवी चल रहा था, और टीवी में एक सीरियल चल रही थी जिसमें बहुत अच्छी तरह वो लोग ने एक डॉक्टर को घर पे इनवाइट किया और PCOS के बारे में पूरे फैमिली से बातचीत करवाई, और बहुत सारे उसमें उत्तर वो लोग उन्होंने एक्सचेंज किए या वार्तालाप किया उसके ऊपर, और बहुत जानकारी मिली। तो हमने सोचा कि RSSDI, जो कि एक बहुत ही क्रेडिबल एसोसिएशन है, उसके एक्सपर्ट्स को क्यों ना बुलाया जाए, और सितंबर जो कि एक PCOS अवेयरनेस मंथ के रूप में मनाया जाता है, तो हम आप सभी की जानकारी इसके बारे में क्यों ना बढ़ाए। तो आज के हमारे विशेषज्ञ हैं डॉक्टर सुरेश दामोदरन, हु इज अ कंसल्टेंट एंडोक्रिनोलॉजिस्ट फ्रॉम द सिटी ऑफ चेन्नई। ये एक्सपर्ट जो है हमारे, वो एंडोक्राइन सोसाइटी ऑफ इंडिया के वाइस प्रेसिडेंट है और बहुत सारी इंपॉर्टेंट पोजीशंस भी होल्ड करते हैं। वेलकम डॉक्टर सुरेश टू दिस RSSDI Diabetes Bytes conversational show. And we also welcome Dr. Arundhati Dasgupta, who is a leading endocrinologist and a senior expert from the city of Siliguri. Welcome, Dr. Arundhati. And she is the medical director at Rudraksh Medical Center, and is a very senior expert with several societies, and as well as key opinion leader for RSSDI as well. So welcome to the show. You both have to unmute yourselves. We are not able to hear you.
No, we didn't talk. We wanted you to talk, so we just unmuted ourselves.
Okay, so now that we have... Sorry, go ahead, please.
No. I think the city of Coimbatore has been very small compared to Chennai. So I'm from Coimbatore, a small place called Coimbatore.
Right, sorry, I said Chennai, but yes, Coimbatore. He's the king of Coimbatore. I'm sorry for that, but yes. And so welcome once again, and I apologize for that error. But I also, I think moving on, I'd like to rope you into this as to, can you share with our audience, because it is so loosely and so commonly used that isko PCOS hai, usko PCOS hai. So, what exactly is PCOS? Are we overusing the term? And, who does it really affect? What is that age group also that should be concerned about PCOS? Dr. Suresh, we'll start with you.
Well, Dr. Arundhati can start. Do you want to start, maybe? Yeah. Well, yeah. Your voice is not heard. Yeah. Okay. Can you hear Purvi, Dr. Purvi? Can you hear Madam?
Yeah.
You can hear her?
I'm able to hear her yet.
I can't hear her.
Can you hear me? It's very soft.
Very minimally.
Please go ahead while I just take notes.
Okay. Well, I think polycystic ovaries is a very complex entity in terms of diagnosis. So you can label someone easily, as you rightly said, but on the other hand, that it gets undiagnosed for a very long time, because certain people, they diagnose it with an ultrasound and they wanted an ovary to be having polycystic nature, and that's the way they diagnose. Now, it has to have, it doesn't need to have all the things. For example, a simple way to diagnose is, I'll just come with a criteria called Rotterdam criteria. There are almost, if you go into the data, there are so many diagnostic criteria, very, very confusing throughout the world. I'll just simplify for the audience and just make it very, very simple. So, three things that you have to see. One, uh, patients should have anovulation or some disturbances in the periods. Okay, that's criteria number one. So, some period disturbances or anovulation. So, for example, if a lady is just fertile every month there is a regular periods, then you can consider that maybe a normal, because normal ovulation happens. But when you do have some trouble in periods, then you should consider as an anovulation or a different ovulation. Okay, so that's one thing. Second thing is the hyperandrogenism, that is decrease in the female hormone and increase in the male hormone, which is called androgen. So the male hormone, which is androgen, will have all sort of male pattern. So male will have the frontal baldness, and the skin will be very creasy. You will have pimples, and you will have period disturbance, and you will get a very, very terrible mood swings, which can be very aggressive and other things. So all this will come under the criteria of hyperandrogenism. So if you do have these two, along with, if you do a scan, for example, if you get a cyst in the ovary, which is called polycystic ovary, then you got it. So you got three. Out of these three, any two will be able to make the diagnosis. So hope you understand. So I mentioned about the periods, I mentioned about the androgen excess, which is the male hormone going up, and I mentioned about an ultrasound finding that showing a scan showing multiple cysts in the ovary. So out of these three, if you do have any of those two criteria, then you got a diagnosis. So it is as simple as that I'm describing, but this is the way that one of the criteria is called modified Rotterdam criteria. As I mentioned, there are multiple criteria are available, but I think we should just stick to this. It's very, very simple and easy to remember. Arundhati, maybe I'll just leave.
Wonderful. Thank you so much, Dr. Suresh, for simplifying that for us. Dr. Suresh sir का कहना यही था कि PCOS जब डायग्नोसिस या निदान होता है, जबकि दो क्राइटेरिया, ये तीन चीजों में से पॉजिटिव होते हैं, और ये आपको खुद नहीं डायग्नोज करना है. One must go to a qualified endocrinologist or a physician or a diabetologist, whoever they are referred to, and seek appropriate help. जब लड़कियों के पीरियड्स में कुछ इरेगुलरिटी होती है, या उनको उनमें जब मेल हार्मोन ज्यादा मात्रा में पाया जाता है और उसके सिम्टम्स दिखते हैं, तो वो साइंस दिखती हैं, तो हमें डॉक्टर के पास जाना चाहिए ताकि वो सोनोग्राफी कर सके और देख सके कि कुछ रियली पीसीओएस के जैसा है कि नहीं है. इसका निदान आप खुद ना करें, स्वयं ना करें, आप एक क्वालिफाइड एंडोक्रिनोलॉजिस्ट के पास ही जाके उसका निदान करवाएं. सो हाँ, हम बहुत लूजली कह देते हैं जब कि लड़कियों के पीरियड्स में इनको पीसीओएस है, पर वो हर चीज पीसीओएस नहीं होती है. तो ये समझ बहुत जरूरी है, और डॉक्टर सुरेश ने हमें बहुत अच्छी तरह समझाया है. I'd like to pose the next question to Dr. Arundhati. So what are the risk factors for PCOS? Does every teenage girl suffer from it, or is every irregular period linked with PCOS? What are the pointers towards PCOS, and what are the risk factors?
Right. Thank you so much, Purvi, for the question. I hope you can hear me better. I had to switch to the mobile because there was a problem with the laptop. Yeah. So first जो आपने कहा कि is every period irregularity, is it PCOD? I mean, that is a very common thing that is done. And as Dr. Suresh had just explained, a lot of times girls have this irregularity in their menses and they go and get an ultrasound done, and the ultrasound says something very vaguely. There are multiple cysts, and then the patient is labeled as PCOD. So but then we've understood that PCOD is very different because it has a lot more to it. Yes, indeed, genetics has a very strong role to play. But this is it's a disease, or it's a condition. I'll not say a disease. It's a condition which is very much like diabetes, wherein there is an interplay between genetics and the environment, right? So if a girl is there whose mother had PCOS or her sister has PCOS, then her chances of getting PCOS are much higher. There are a lot of genetic aspects to it. But again, there are other environmental factors which kind of trigger something which we called insulin resistance. And today we've understood that insulin resistance, which is the key word in type 2 diabetes, that also has a role to play in the manifestation of PCO. So maybe genetically you could be prone to PCO, but if you have a good lifestyle, if you are otherwise not insulin resistant, then your chances of getting a phenotypic or a PCO problem like irregularity of your menses or say increased hair growth, these are much lesser. So when you say at risk, family history is one risk, family history of diabetes is another risk factor, sedentary lifestyle is a risk factor, putting on weight is a risk factor, other factors that increase the insulin resistance of the body, these are other risk factors. And certainly not every lady who has a irregular mens has PCO. As Dr. Suresh would have said, I just missed out that part, that it's only after ruling out certain other problems that you come to the diagnosis of PCO. So we rule out a hypothyroidism, we rule out other conditions like say increased levels of prolactin hormone, we rule out some other hormonal conditions, and then only we call it a PCOS.
बहुत सुंदर तरीके से समझाया. Go ahead, Dr. Suresh.
No, I think that is wonderfully described actually by Arundhati. She explained that it is sort of metabolic thing. When the family do have it, you can definitely overcome it by improving your lifestyle. And if you do that, you don't get into this complex condition. So this complex condition involves number one, metabolic, number two, pituitary, which is a gland which is present in the brain, and number three, adrenal gland, which is present just above the kidneys, and also the ovaries, which is the lady's sex organs, which is there. So it is a complex discussion between all these organs to get a syndrome. It is not a disease anymore. It is a syndrome which comes with a full package of multiple things that is present at multiple stages. An anovulation, it can be just excessive sweating in the face or a hair growth in the unwanted areas. And the wanted areas, there will be hair loss. There will be multiple things that it can be presented. So the risk factor wise, as doctor mentioned, you can definitely overrule it or overcome it by just improving your lifestyle. But some other conditions, like people are on anti-epileptics and other things, we should be very careful. And there are a lot of evidence to show that you can be prone for PCOS. But definitely, lifestyle is the one that everybody has to know. If you want to take one thing out of this talk, if you just improve your lifestyle with PCOS, you can almost get rid of it, or almost can avoid all the complications that comes out of PCOS.
Wonderfully described, both of you. I think Dr. Arundhati described all very well, and then Dr. Suresh really hit the nail. All I have to share with the audience is that ये एक अपनी जीवन शैली से कंडीशन है या एक स्थिति है, तो ये एक डिजीज नहीं माना जाता है. अब ये खाली कंडीशन है और हमें बहुत ही सावधानी से परखना है, क्योंकि अपनी जीवन शैली अपने हाथों में है. तो जैसे कि डॉक्टर अरुंधति ने समझाया कि इसमें ज्यादातर एक फैमिली हिस्ट्री का भी रोल होता है, और अपनी जीवन शैली, जैसे कि आप बहुत ही फिजिकली एक्टिव नहीं है या बैठे रहते हैं पूरा दिन या पढ़ाई करते रहते हैं लंबे घंटों तक और उठते नहीं है बीच में या काम करते रहते हैं कंप्यूटर पे और बिल्कुल उठते नहीं है, तो ये सब एक सेडेंट्री लाइफस्टाइल में काउंट होता है। तो ये एक चीज है जिसे आपको तोड़ना है और ज्यादा एक्टिव होने से भी पीसीओएस में काफी फर्क पड़ता है। और मोटापे के साथ भी ये बहुत ही पास से जुड़ी हुई है ये कंडीशन। तो जब ज्यादा वजन बढ़ता है और बढ़ते ही जाता है और उसमें हम कोई खाना पीना या उसमें कोई रोक नहीं लगाते हैं तो ये पीसीओएस डेवलप हो सकता है। तो सबसे ज्यादा इम्पोर्टेंट है कि फैमिली हिस्ट्री होते हुए अपनी जीवन शैली हम किस तरह निभा रहे हैं। और वही डॉक्टर सुरेश कहना चाह रहे थे कि आप इसमें कोई डरने की चीज नहीं है या घबराने की चीज नहीं है। इसमें होता है, काफी सिम्टम्स होते हैं जो हमें लगता है कि ये ठीक नहीं हो रहा है, जैसे कि लड़कियों में मुंह पे बाल ज्यादा आते हैं या जिधर हमें नहीं चाहिए या वो सब बढ़ता है जैसे लड़कों में होता है। तो वो सब हमें डरा सकती है कि पीसीओएस की वजह से हमें हो रहा है। पर अगर हम मोटापा कम करें या बहुत अच्छी तरह एक्टिव लाइफस्टाइल जिए तो ये सब हम कम कर सकते हैं। तो यही वो कहना चाह रहे थे और बहुत सुंदर तरीके से समझाया उन्होंने। तो अब मैं पूछना चाहूंगी डॉक्टर अरुंधति में, ये भी हमारा अगला सवाल था कि ये फैमिली हिस्ट्री इसमें कितनी इम्पोर्टेंट है, उन्होंने वो भी जवाब दे दिया है। सो मैं दोनों को पूछना चाहूंगी अभी कि वो बताएं हमें कि व्हाट आर द क्लिनिकल पॉइंटर्स, अगर आप एक बार और हमें समझा दें कि क्या क्या हो जबकि हमारे पेशेंट्स डॉक्टर के पास जाए या उन्हें एक मेडिकल प्रैक्टिशनर और या एक क्वालिफाइड डॉक्टर की सलाह लेनी चाहिए। ऐसे क्या क्या क्लिनिकल पॉइंटर्स है? We can start with you, Dr. Arundhati. Yeah.
Okay. So जैसे अगर आप देख रहे हैं, यूजुअली वी हैव समथिंग, अगर एक 28 डे साइकिल होगा या 21 डे साइकिल होगा किसी में, या 30 डे साइकिल होता है, एक पैटर्न होता है पीरियड्स के। सो अगर आप देख रहे हैं कि यू नॉट गेटिंग योर पीरियड्स फॉर 2 to 3 months एट अ स्ट्रेच, यू नॉट गेटिंग, और वेरी इरेगुलर, कोई टाइम नहीं है, जब कभी भी आ रहा है और हो भी रहा है तो इट्स जस्ट स्पॉटिंग, बहुत हल्का सा ब्लीडिंग हो रहा है, 1 दिन या 2 दिन रह रहा है, मिनिमल ब्लीडिंग, एंड देन अगेन you're not getting your period for a substantial number of days. So something that is called oligomenoria or amenorrhea. Amenorrhea मतलब पीरियड नहीं आना, oligomenoria यानी कम ब्लीडिंग होना। So ये वाले प्रॉब्लम्स अगर है, नंबर 1. Number 2, if you're seeing abnormal hair growth as we just described, there are some areas of normal hair growth, there are some areas of abnormal, मतलब male pattern of hair growth जो होता है, जैसे कि chins में, sides में, अपर लिप वाले एरिया, चेस्ट में, एब्डोमेन में, ये वाले कॉमन एरियाज नहीं है लड़कियों के लिए हेयर ग्रोथ का। तो अगर आप देख रहे हो कि नहीं हेयर ग्रोथ ज्यादा हो रहा है, then again the hair growth pattern is very different even in our country. Say in the northeast people do not have minimal hair growth, also females do not have, whereas in the east and in the north also some amount of hair growth is normal. So you would have to kind of relate it with your pattern, your family pattern. एंड अगर आपको लग रहा है कि नहीं इसमें तो मेरा जो हेयर ग्रोथ है वो ज्यादा है या बच्ची में जो हेयर ग्रोथ है वो ज्यादा है, तो ये दोनों चीज बेसिकली आपको देखना है कि पीरियड इरेगुलर हो रहा है और फ्रंटल बॉल्डनेस हो जाता है, मतलब टेस्टोस्टेरोन लेवल जो है वो बॉडी में अगर ज्यादा हो जाए तो क्या होगा, मेल पैटर्न ऑफ बॉल्डनेस। मेल पैटर्न ऑफ बॉल्डनेस मतलब जो फ्रंटल एरिया है, हमारे सामने वाले एरिया जो है वहाँ पे हेयर कम होता जाता है एंड एबनॉर्मल एरियाज में हेयर ग्रोथ आता रहता है। तो ये दोनों चीज अगर आप देखें कि हो रहा है तो then immediately take a consultation, because it might be because of PCOS, might not be also, कुछ और कारण से भी हो ही सकता है, बट ये एक्चुअली को रूल आउट कर लेना है कि यहाँ पे PCOS का प्रॉब्लम तो नहीं है।
ग्रेट, बहुत ही सुंदर तरीके से समझाया और आसानी से समझाया ताकि हमारी ऑडियंस को समझ में आ जाए। Dr. Suresh, does diabetes have any connection with PCOS? Family history of diabetes is an important risk factor that can make you vulnerable to PCO. But what is the exact connection between diabetes and PCOS?
Well, I think
If you
it's a
could
very
share
important.
that.
Well, I normally tell my patient for them to understand about this condition and the seriousness of this condition. What I will tell them is normally for a woman, this is like a pre-diabetes. So when you do have a PCOS, it is like a pre-diabetic condition. So before diabetes, you get into PCOS, that kind of thing I will say to the patient. So normally that will get them going, for metabolically. But the link is the insulin resistance. I think Dr. Arundhati was mentioning earlier the insulin resistance with multiple complexity with the environment, and it can work on some people, it doesn't work on few people. But so when you do have a family history of insulin resistant with multiple people in the family have got PCOS, multiple people in the family has got type 2 diabetes, if you do have all that, then you are highly prone to get PCOS and type 2. So PCOS, if you let it go, then it'll if you metabolically not active and if you have not done enough diet or exercise and everything, there is a high possibility to get into type 2 diabetes. So insulin resistance is the key. So when you do have insulin resistance, then the receptors happens. What happens is the hypothalamus pituitary axis, when there is a secretion, it's like a gonadotrophin secretion is like a pulse generator. It will be like tap 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 tap, it will be releasing like that. The gonadotrophin hormones that goes to the ovary and then secretes the female hormone. But when the insulin resistance is there, there get a multiple confusion in the pulse generator, and then the secretion will be affected in a different way. So the secretion from the ovaries will be much more confused. You will get much more androgen compared to estrogen, and that is the one that is causing the symptoms. So there is a direct link between PCOS and diabetes, and I would label most of the people as a pre-diabetic. So the best thing to do is, as I said in the first thing, and Dr. Arundhati was mentioning, diet and exercise. You can get a technology help or without it, but diet and exercise will be the way forward.
Excellent. I think that was a very important message that you have given our audience today. कि PCOS एक प्रीकर्सर कंडीशन माना जा सकता है डायबिटीज के लिए, क्योंकि वो दोनों में एक कॉमन लिंक है जो कि इंसुलिन रेजिस्टेंस है। और इसी वजह से जो कम उम्र में पीसीओएस जब होता है तो डायबिटीज उन लड़कियों में होना बहुत ही ज्यादा उनका रिस्क बढ़ जाता है उसके लिए, और उसी के लिए हमें जीवन शैली बदलनी है, मोटापा कम करना है, एक्सरसाइज रेगुलरली करनी है, और डाइट भी संभाल के चलना है, डाइट पे भी। तो that was very well explained. Dr. Arundhati, would you like to add anything to that?
The only thing that I would like to add is about being cautious about gestational diabetes. I mean, people who have PCO and then they conceive, their chances of getting diabetes during pregnancy, which we call gestational diabetes, is much higher. So the screening should be adequate. Sometimes what happens is a lot of times when they conceive, they check the sugar level and it's normal, and then they just let it be. They forget about it because the sugar level was normal and I never had a history of diabetes. But gestational diabetes is something which is going to come up much later after the third month generally. So, you would need to keep checking the sugar levels because remember you had PCO, and PCO is just one part of an entire spectrum. A spectrum which involves diabetes, it involves hypertension, it involves dyslipidemia, and pregnancy is a period in time wherein the risk of getting diabetes because of various hormonal factors is increased, particularly in this subset of patients. So apart from what Dr. Suresh has told us, that the chance of getting diabetes is more, you should be checking lifestyle, diet. Also be cautious about gestational diabetes. That's just it.
Well, I think you nailed it. And one other thing I want to say is every stage of a woman's life, if you do have a PCOS, it is very, very important to know there is multiple effects it can do. Early stages, it can be a young girl, then that the periods will be a concern. And then going into the next stage, for example, the fertility will be an issue. And then the next stage, that hair and all the acne and the mood changes and depression, the whole lot, that will be an issue. and then after that the type 2 diabetes and the dyslipidemia and other things comes into play, and after that it's a cardiovascular disease. So it is a progression in almost each stage of a woman's life. So to know more about this condition and awareness about more about this condition is very, very important. People talk about type 2 diabetes a lot, and then about hypertension and then cancer a lot, but this PCOS, which is the commonest endocrine defect in the world, has to be discussed more amongst the women.
One more thing, Purvi, if I may just add, while we are talking about pregnancy. What happens in PCO is that a lot of time they do not get their periods, right? And sometimes they conceive in that period. And they do not realize because they're so used to not getting periods for 3-4 months, right? And sometimes they're on medications that should not be given when the lady is pregnant in the first 3-4 months, because that has happened to our patients. We do tell them that every time you're not getting your period, you should be checking your for pregnancy, because we've had patients. I'm sure all of us have seen patients who conceive and they do not realize, and by the time they realize, it's almost the 3rd-4th month. And sometimes they're on antihypertensives or maybe say medications for cholesterol, which are not given in the first trimester. So that is why this is one area that every female who has PCO, married female who has PCO and is not getting her menses, she must be careful about this.
Well, that is a very, 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 very practical point which you can't hear anywhere. So, a woman with abnormal periods, they think that they are okay. They're getting medicines from somebody, and then they will be okay. And it's been the case for 4-5 years, and it is nothing abnormal to them. But when they become sexually active and everything, when they get pregnant, you have to be very, very careful. One more point is, as Dr. Arundhati, she mentioned it already. A person of a PCOS going into pregnancy, then early pregnancy itself, don't think that you might get diabetes after only 28 weeks. So that it is like an iceberg, like when you have the water shrinks in the mountain comes out in the sea, that kind of thing. So when the pregnancy enters, it is much more insulin resistant state. So much more insulin resistant than what she's already got. So when the pregnancy enters in, and then the diabetes comes out, so it can be an early type 2 diabetes that can manifest in a PCO woman. We should be very, very careful about it. So don't think that it will come only the later stage. Dr. Arundhati has mentioned that very clearly. So you should think about it. So early pregnancy in a PCOS woman with an abnormal period should be thought about, and then early diabetes in a PCOS woman getting early pregnancies also should be thought about.
Excellent. I think they were very, very key messages and practical points for our women suffering from PCOS. एक तो आपको ध्यान रखना है कि आपको गर्भावस्था में आपको डायबिटीज जल्दी हो सकता है पीसीओएस के वजह से, तो आपको रेगुलर चेकिंग करनी है और उसे टालना नहीं है. आप अपने डॉक्टर के साथ बहुत ही पहले ही आप शेयर करें कि आपको पीसीओएस है. अगर आप कोई नए डॉक्टर से मिले हैं जिनको पहले नहीं पता है आपकी हिस्ट्री के बारे में, तो ये शेयर करना बहुत जरूरी है, क्योंकि आपको डायबिटीज के चांस हो सकता है, और वो भी बहुत पहले ही गर्भावस्था में हो सकता है. और दूसरा ये है कि हर एक स्टेज पे कुछ ना कुछ पीसीओएस के वजह से मेटाबॉलिकली हो सकता है, और वो भी हमें ध्यान रखना है उसके बारे में, और रेगुलर स्क्रीनिंग करनी है उसके बारे में. तो क्योंकि हमारे पास समय कम है, मैं जल्द ही दूसरा सवाल पूछना चाहूंगी कि do women with PCOS, they generally are assumed to have infertility problems, but what kind of problems, and how is it a rule that they always have infertility problems? Should that prevent them from getting married? How does that work?
So certainly it's not the rule that everybody who has a PCO, underlying PCO will have infertility, certainly not. But obviously the chances of infertility are much higher in patients with PCO, because this is a condition जिसमें ovum जो है वो बन नहीं रहा. It's a condition of anovulation. मतलब normally हमारे ovary से ovum बनता है, and that is how the eventual pregnancy is going to take place. But जिनका ovum बन ही नहीं रहा, तो वो anovulation हो गया. अब ये रहता है कि हर एक साइकिल में ओवम नहीं बन रहा है, ये नहीं हो रहा है, किसी में हो रहा है, किसी में नहीं हो रहा है. So it's not necessary that she's not going to conceive on her own ever. She might conceive, because in some of the cycles she's getting ovulation, but the chances of infertility are high. So that is why when we look at a female with PCO, our concerns are always different at different stages of life. Initially it is about in the pre-myriad state, that is about when she's not getting her period. It's about the increased hair growth. It's about her looks. She's more concerned about her looks and the fact that she's not getting her periods. At a subsequent period, then she's not conceiving. Infertility is a big problem. Miscarriages are also higher. So then, depending on the characteristic, the phenotypic presentation of PCO can be very different. Somebody might just have one problem and not the other. Somebody has no hirsute, no increased hair growth, but she has a period problem. Somebody will not have any of these periods. She's had a normal period. कुछ भी नहीं हुआ. पता ही नहीं चला कि PCO है. But then she's not conceiving, and then you test, and then you realize that she has an infertility. So the phenotypic variation of PCO is vast. So ज़रूरी नहीं है कि PCO है तो you should not get married. Certainly not. Certainly not. There is no reason why you should not get married, because even if you have PCO and you have infertility because of that, there are solutions to that. There are definite solutions to that. So that cannot be a reason of not getting married. There can be other reasons, of course. We'll not discuss about that now. but PCO is not one of them, definitely not. And infertility is very much, infertility in PCO is something that can be taken care of. There are medications that can take care of the infertility, to a large extent. But the first thing that works in PCO, be it about menstruation, be it about anything else, is lifestyle change, is exercise and lifestyle change. So many times we've had people who've lost weight and they were getting treated for infertility, in PCO, and then they come to you and somehow you manage to tell them that, you need to lose weight, and they come back very determined, lose weight, and they conceive on their own. They do not need any help at all. So that is the major thing that needs to be done at every point of PCO, no matter what.
Wonderful. Thank you so much. That was a key social message as well. Ki PCOS is not a condition where marriage can be a problem, or fertility issues are quite variable, and they may not all be linked with PCOS. And even if they are, a good lifestyle can help you overcome that, and there is medical assistance available to overcome that as well. So do not make it a reason to not be married, or not conceive. Anyway, that's besides the point. Dr. Suresh, are birth control pills the only answer to PCOS, and how do we really manage PCOS? And is there anything specific that we can do? I know you've given us key messages throughout the show, but is there like a final message that you would like to give for preventing PCOS as well?
So I think you asked a very, very important question, that you got a diagnosis after all the complexities I mentioned about diagnosis and everything. Somebody getting the diagnosis, then how do you manage from there? Whether they label them as a diseased person, and then manage them psychologically. How do you do it? I think just once you get the diagnosis, the best thing to do is what I was saying. The key point that you have to take out from the talk is the diet and exercise. You do diet, whatever the way diet you like, and whatever the way that works for you, please start doing it. And there is a lot of precision medicine and precision diet is going in. And then the exercise wise, whatever you can do, aerobic or run or whatever you want to do, just start doing it. So this is the gold dust for PCOS: diet and exercise. Once that is, the next step would be to give, we do give some tablet called metformin, which is a diabetic medication that has to be given for overcoming the insulin resistance. So that can be given as a one line treatment. And then if you do have challenges with androgen excess, then you go into the birth pill, and then you go for anti-androgen drugs, and you go for alpha reductase. There are quite a lot of other drugs that is used as second, third line, or whatever. Triple therapy is there, but whatever it is, I think that's all the last stages, or the stages, symptomatic management. So whoever got what symptom, then you manage accordingly. But your question is whether the birth control pill is the only treatment. The answer is not. I mentioned the gold dust treatment first, and then you can go for the symptomatic management according to what a person has got. And your question regarding prevention, yes, you can prevent it, Dr. Arundhati. Even the first thing what she mentioned is, even if your family has got it, don't worry about it, just work on it. It is like having a challenge in your front, in your hand. You have to act on that challenge. So you know that you will be a diabetic and a PCOS woman. If you're not acting on it, please act. The acting will be diet and exercise.
Yes, I think very, very key messages that, a large part of it is in your hands and you don't have to feel disappointed, but you actually have to take it as a challenge and work on it or address it. And, lifestyle changes are, again, key to this entire aspect of PCOS as well. Any final messages from our RSSDI experts today?
But one
I
other
think
point, as Dr. Arundhati was mentioned, is I think doctor has mentioned about ruling out the other endocrine causes, which is very, very important. So don't take it granted that a person has got PCOS on the basis of one or two things. So get a proper workup, late onset CAH or ovarian secreting tumors, androgen secreting ovarian tumors, or whatever you want to do. I think get it done through an endocrinologist.
Well said.
Madam, you want to say, Dr. Arundhati was about to say
So I
something.
just wanted to say that the final message is what the first message was and what the message was in the middle. The lifestyle changes form the key. I'll just tell you that I was giving my DM exam, and you're so tense when you're giving your DM exam. So my one of my cases was a PCO case. So my examiner asked me, what will be there in your prescription? So I started mentioning this medicine and that medicine, and then he said that you're not going to pass if you don't say all those things. And then I said, oh my God, I didn't say lifestyle. So lifestyle changes have to be the first thing in our prescription. It has to be the first thing in the patient's mind. And ever since I've not forgotten, thankfully I passed. And then ever since I've not forgotten. But the point is that remains the key word. If you think that your doctor is going to write a medicine and that's going to solve your problems, it's not going to get solved. It's not going to get solved. Unless you make conscious efforts to root it out from the basic pathophysiology, which is decreasing the insulin resistance, and that can only be done by exercise. There are some females who get PCO who are lean; they're not obese, so they think that why would I need to exercise? My figure is fine. So that is not the answer. You could be lean PCO, you could be an obese PCO, you could be an absolutely fit PCO in terms of the BMI. But exercise forms the basic keyword, and of course, proper dietary measures to be taken. So that would be my final message, Purvi.
Excellent. I think really, yes, and then we did miss, talking about the lean PCOS, but excellent points made even in the last, key messages that we really need to focus on lifestyle क्योंकि वो आपके हाथ में है और दूसरा कि आप ये PCOS बहुत कॉमनली यूज होता है ये टर्म बट उतना कॉमन नहीं है ये और आपको सही निदान अपने डॉक्टर के साथ अपने सब सिम्टम्स और साइंस आप डिस्कस करेंगे तभी आपके डॉक्टर से सुनिए कि ये PCOS है तो ही मानिए कि ये PCOS है नहीं तो आप उसे ऐसे मत समझिए कि हर चीज PCOS होती है and I think the key is to seek timely medical help and of course focus on a very very healthy lifestyle because that is something that's in your hands and you can definitely focus on that. So thank you once again. A big thank you from our National President, Dr. Vasant Kumar Sir, our National Secretary, Dr. Sanjay Agrawal Sir, and the entire Executive Committee, as well as the Social Media Diabetes Bytes team. Dr. Faraz, my co-chair or co-host, is also an integral part of this. And we thank you both for sparing your time and being here for RSSDI Diabetes Bytes on a very, very interesting discussion and excellent points shared by both of you. So thank you, Dr. Suresh Damodaran once again and Dr. Arundhati Dasgupta. Thank you so much for joining us.
Thank you, Dr. It was excellent.